Emergency rooms provide crucial medical care, but for non-life-threatening situations, did you know urgent care can often serve as a faster and more affordable alternative? Here with more about when to consider urgent care, Healthcare Partners physician Dr. Rakesh Kalwa. Good morning to you. Welcome.
Good morning. Thank you for having me.
Well, a lot of people think when they have an emergency situation that pops up that they should go to the ER, and that's not necessarily the case. And why is that?
You're exactly right. It's not always necessary to go to the ER for every type of illness or injury. It's estimated that 27% of all ER visits can be managed in the urgent care. Approximately $4.4 billion annually that can be saved. So it's strongly recommended that you get to know where the local urgent care is, what hours of operations they have, and what kind of services they offer.
So it can be very expensive going the ER route versus the urgent care route if it's something that can be taken care of at urgent care.
Exactly.
And let's talk about some of the things that you can handle at urgent care.
Well, urgent care, they can handle basically illnesses and injury that are mild, such as fevers, cough, cold, congestions, allergies, urinary tract infections, rashes. But our 4 healthcare partner locations also offer on-site labs, on-site x-rays, IV fluids, breathing treatments, and they can do stitches if necessary.
So you can treat the person there and do the blood work or perhaps the diagnostic side of it there.
Exactly.
So you can take care of it and not get charged the ER rate.
Exactly.
For the ER situation, when do you go to the ER?
Well, the ER, typically if you're having major symptoms such as signs and symptoms of heart attacks, strokes, seizures, major bleeding, or you have a severe broken bone where your bone is sticking out, you definitely want to go to the ER. And then we also recommend, if you're having a life-threatening emergency, to call 911.
And when 911 comes, they usually take you to the ER?
Yeah, usually they do.
Now let's talk about the hours for urgent care. Are they typically 24 hours or just extended hours?
Yeah, usually urgent cares are open weekends and evenings. Healthcare Partners locations offer evening and weekend hours, but our one location is open 24 hours a day, 7 days a week. So
let's say if you are new to town or you're transitioning between doctors and you need care, it's okay to go to the urgent care versus the ER?
Definitely.
And let's talk about, again, the health issues that can be treated. A lot of people they've got kids and they'll wake up with a fever. So if that's the case, you don't need to go to the ER.
Correct. You can definitely come on to the urgent care. And if necessary, if you're not sure if you should come to the urgent care or ER, we'll be happy to redirect you if necessary.
And that's something that's can you actually just call your office or call the place and say, is this something that should be treated at the ER or urgent care without even coming in?
Exactly. We have a nurse that answers the phone calls 24 hours a day.
And obviously the staff there, it's a lot of people there to help you as well. And in the ER, can the wait times be really high?
Exactly. Typically in the urgent care, you find that you get seen pretty quickly and at a fraction of the cost.
Yeah, that's fantastic. Now, we know that Healthcare Partners does a fantastic job providing healthcare services for patients under the total care model. What exactly is that?
Well, the total care model, we see it as a VIP service to our patients and no extra cost. It's a dedicated team of physicians, specialists, and staff that work together to manage the patient's overall health.
It's basically streamlined so that the patient can go in there, doesn't have to fill out more paperwork. So It's really nice. Well, doctor, thank you so much for some great information today.
Thank you for having me.
To learn more about Healthcare Partners and to find the nearest clinic, you can visit the website right there on your screen. Still to come.